You know, we at FNIH really aim to be an exemplar of patient-centric research. So our whole organization is committed to achieving that through our Patient Engagement Council, our Patient Summit, and our end-to-end intent to meaningfully include patients with lived experience in all phases of our work. So we're fortunate to have the support of a very special group of people, our patient ambassadors, some of whom are with us tonight. These are exceptional people who share their lived experiences to inspire and inform others about our programs and the importance of our work. So we're going to hear from one of our patient ambassadors, someone who for many years has advocated for people with Sjögren's disease and who has become a true partner to the NIH in the last few years. You might not realize that about 4 million people are affected by Sjögren's disease, but about half of them are undiagnosed. So Janet Church, the president and CEO of the Sjögren's Foundation and a patient living with Sjögren's disease, hopes to change that. So please welcome her to the podium. Thank you, Janet.
Thank you so much, Julie. And I am absolutely honored that the FNIH asked me to share the patient perspective this evening and my personal experience working with them. So as Julie said, I am a patient living with Sjögren's disease. And I thought I'd share a little bit about that and about the disease because it is a very misunderstood disease. So Sjögren's is a very complex autoimmune disease with no approved therapy. As Julie said, it affects about 4 million patients. And the disease has long been misunderstood and often dismissed as a harmless, dry eye, dry mouth disease when it is actually a systemic and debilitating disease. I spent years seeing doctors, and then I landed in the hospital with aseptic meningitis and other serious symptoms. It took 9 months after this event and many more symptoms that I was finally diagnosed with Sjögren's. I was told that I was lucky that I had the easy autoimmune disease. So this clearly was not my experience. So I found a provider familiar with the neurological symptoms of Sjögren's and really an expert in Sjögren's. I was 40 at the time. And now that I know a lot about Sjögren's, I know I presented with classic symptoms beginning at age 8. So when I got the call from the FNIH that Sjögren's was being added to the AMP-AIM program, I jumped at the opportunity to fund at the steering committee level. And this opportunity to have an equal voice in program design, along with researchers and industry, was an incredibly significant opportunity for Sjögren's. My first request was that the FNIH be an early adopter of our new name, Sjögren's disease, and to never use the term Sjögren's syndrome. Our new name is incredibly meaningful to patients. And when Steve Hoffman agreed to this, it was clear that the patient voice would not only be heard, but implemented. That was 3 years ago, and during this time, I've seen the expansion of their patient engagement department and their focus to ensure the patient voice is incorporated. They now have the Patient Engagement Council of 12 people. They work with 65 patient advocacy organizations, and they gather patients with lived experience through those nonprofits. And they engage with 8 of us, who are the FNIH patient ambassadors, to present the patient perspective to researchers and industry, such as this event. We all share a similar definition of patient centricity, but it is really proving challenging to adopt. Currently, there are 10 companies sponsoring Sjögren's clinical trials, but because of limited research about the disease, many of the most challenging symptoms for patients are not being measured. Had the patient voice been incorporated earlier, this could have been addressed. The FNIH has a unique position. Because they bring all stakeholders together, they see the sticking points where the patient voice is not readily accepted, and they're looking at how to address these areas. And recently I was speaking to FNIH staff about taking these learnings and creating a training program that all stakeholders receive. They are truly laying good programmatic, non-competitive groundwork for a model that can be adopted by all, whether in corporate research, basic research, and even clinic. I'm excited to continue this work and help drive a model that brings the patient voice into research design early enough to make the greatest impact for the patient. I want to thank the FNIH for being a driving force for this change. I think it really will make an incredible difference, and we are so grateful that you listen to the patient voice.